Do you frequently feel like your heart is racing, or your chest hurts after sniffing things like glue, paint, or cleaning sprays? What if I told you that something as simple as inhaling fumes from a marker or aerosol could seriously harm your brain and heart over time? That's what inhalant use disorder (IUD) is about. It's when someone keeps using everyday household products to get high, even when it hurts their body or life. Imagine a teenager, let's call him Raj, who starts sniffing glue from art class just for fun. At first, he feels dizzy and giggly, but over time, he needs more to feel the same, and soon he's missing school and acting strange. That's inhalant use disorder, using inhalants not for work or cleaning, but to escape reality and suffering because of it. What causes someone like Raj to keep using these dangerous fumes? It often starts with curiosity or stress. Maybe Raj had trouble at school or home and found that sniffing glue made him feel calm or happy for a few minutes. These inhalants are easy to get, right from your kitchen or garage. Products like air fresheners, nail polish remover, or spray paint contain chemicals that, when inhaled, quickly reach the brain and cause a short high. For someone feeling lonely or overwhelmed, this escape can be tempting. But your brain starts to believe it needs that chemical rush, just like it might crave sugar or social media. Over time, the brain changes, making it harder to stop. It's not about being weak. It's about your brain reacting to strong chemicals in everyday items. How can you tell if someone has inhalant use disorder? Let's talk about Maya. Her friends noticed she often seemed dizzy, had slurred speech, and smelled like nail polish. She had nosebleeds and seemed confused. She would hide in the bathroom after school. These are common signs. Other symptoms include nausea, loss of appetite, constant drowsiness, or even hallucinations, seeing or hearing things that aren't there. Over time, the body pays a price: memory problems, damaged nerves, or weak muscles. Some people lose weight or have trouble walking. If you or someone you know is using sprays, glues, or solvents to feel different, and keeps doing it despite problems, it might be more than just fooling around. It could be IUD. How do doctors know if someone has inhalant use disorder? The doctor will ask questions. Do you use things like spray paint or cleaning fluid to get high? How often? Can you stop? They don't just guess. They use a checklist from a medical guide. There's no single blood test for IUD, but doctors may check your blood or urine to see if chemicals are in your body. Brain scans might show damage too. The key sign is using inhalants repeatedly, even when it causes problems at school, work, or home. Treatment usually starts with stopping the use, safely, sometimes in a hospital. Then, counseling helps the person understand why they started using and how to cope without it. Therapy like CBT, cognitive behavioral therapy, teaches tools to handle stress. Support from family, like listening without yelling, makes a big difference. For example, when Raj's parents chose to care instead of scold, he began to open up and heal. Can inhalant use disorder be prevented? Yes, and it starts with talking. Imagine a teacher showing students a video of how spray paint fumes can damage the brain, like showing a melting ice cube to represent brain cells dying. Schools can teach kids about the dangers early. At home, parents can keep track of household chemicals and talk openly about why people might be tempted to misuse them, without shame. For youth feeling pressure, loneliness, or anxiety, having someone to talk to, a mentor, counselor, or trusted adult, can stop them from turning to inhalants. Community programs that offer fun, safe activities, like music, sports, or art, give healthier escapes. Prevention isn't about fear, it's about connection and education. What's new in the world of inhalant use disorder? Scientists are now using brain scans to see exactly how inhalants change the brain over time. Recent studies found that certain parts of the brain, like those for memory and decision-making, shrink faster in teens who use inhalants. Researchers are also testing mobile apps that send calming tips when teens feel the urge to use, like a pause button for cravings. One study in Brazil helped street teens quit by pairing them with coaches who used inhalants in the past. This peer support method is showing real hope. Another advance is better blood tests that can detect inhalant use earlier. The message is clear: help is evolving and recovery is possible, even for those